Hello, my name is Kate Dewey. I'm an Assistant Dean and Professor of Epidemiology and Swine Health Management at the Ontario Veterinary College, University of Guelph, Canada. I was the Director of the One Health Institute from 2018 until May of 2025. I'm the Canadian member on the steering committee of the North American One Health University Network. It is my great honor to present One Health in Canada. As you can imagine, this is an impossible task to accomplish in just 30 minutes. However, I very much appreciate the opportunity to share some of the Canadian story. One Health in Canada is functioning at the local level in district public health agencies, where they focus on links between environment, animals, and human health. The conservation authorities built across watersheds take a One Health approach to healthy water, environment, and people, and work collaboratively with partners in the United States to monitor and maintain the health of the Great Lakes. At the provincial levels, we have One Health programs in many ministries. At the federal level, One Health programs and policies are part of the Canadian Food Inspection Agency, Environment Climate Change Canada, Agriculture and Agri-Food Canada, and the Public Health Agency of Canada. Global Affairs Canada is responsible for external affairs. This federal agency funded 5 One Health projects in sub-Saharan Africa, with the aim of reducing the impact of zoonotic diseases and improving the lives of women and girls. Faculty from veterinary colleges across Canada are participating in each of these projects. I am working on the project in Rwanda, led by Veterinarians Without Borders. I'm training community health workers, animal health workers, and hygiene workers to form One Health teams in 85 rural villages. John Van Leeuwen from Prince Edward Island will describe his project in Kenya. Earlier this year, I invited faculty from across Canada to join a Canadian One Health University network. Currently, there are 44 members. The membership list can be found at the link below. In order to hear about One Health in Canada, I invited some of the faculty members from this Canadian network to describe their programs or research in one slide and a 60-second audio. In this presentation, you will hear from 12 universities. These will be followed by 2 long-standing pan-Canadian organizations, the Canadian Wildlife Health Cooperative, with data from every province and territory, and the Canadian Community of Practice in Ecosystem Approaches to Health, has facilitated a multi-site, multi-university field course for 18 years and is described by Dr. Margot Parks from the University of Northern British Columbia. Lastly, you will hear from 2 federal agencies, Environment Climate Change Canada and the Public Health Agency of Canada. Thank you to everyone who participated, and thank you to Pete Kelly from the University of Guelph's One Health Institute, who collated the submissions, and Kevin Hogg, the videographer from OVC, who edited the sound and knitted the submissions together. Now we will present the voices from across Canada. We will begin with 2 5-year One Health training platforms that are funded by the Canadian Institutes of Health Research.
Canopy is the Canadian One Health training program on emerging zoonoses, one of 5 new health research training programs funded by the Canadian Institutes for Health Research in 2024. Canopy represents a committed cross-Canada team with expertise in laboratory sciences, medicine, equity, and communications, who are working to train highly competent personnel capable of excellence in health research on emerging zoonoses using a One Health approach. To achieve this goal, we are building a connected community of researchers and practitioners who will collaborate and innovate to build and sustain health capacity and resilience, ultimately to better prevent, prepare for, and respond to current and future threats caused by emerging zoonotic pathogens.
CAN-AMR-Net is a national health research training platform funded by CIHR. It is designed to address the growing global challenge of antimicrobial resistance through a One Health perspective. The network's mission is to train the next generation of AMR researchers, professionals, and leaders, to promote transdisciplinary collaboration, communication, and knowledge translation, and to support the development of evidence-based policy and practice to mitigate AMR. Coordinated by the University of Calgary, the network brings together over 25 institutions and partners, with hubs in British Columbia, the Prairies, Ontario, Quebec, and Atlantic Canada. The network is open to graduate students, faculty, researchers, and knowledge users in AMR and One Health fields. The network's 4 pillars are One Health AMR translational competencies, transdisciplinary training and career readiness, excellence in communication and knowledge translation, and the integration of Indigenous knowledge and community-led research.
Hi, my name is John Van Leeuwen, and I'm a professor at the University of Prince Edward Island. I've been involved in the Gender Responsive One Health project, which has 5 partners, 3 vet schools in Canada, 1 Canadian charity, and 1 Canadian international development company. And our project is in Kenya. 2 of the main goals are to enhance the Meru County animal and human disease surveillance systems and to provide One Health training programs that are involved in in-person seminars, providing resources, doing some training of trainers, and SMS messaging on cell phones. We're providing the training to paravets to enhance their ability to handle clinical cases and herd health, and done in groups and one-on-one. And this is done with the assistance of a local university to enhance sustainability. We're also training local slaughterhouse employees and inspectors, community health promoters on zoonotic diseases and others, school teachers, students, cooks, gardeners for their lunch program, some local dairy farmers in their clubs, and women's group farmers for poultry, small ruminants, and beef. This is all done with a gender action learning systems lens to enhance women's roles and then involve the men and making sure that their roles are also enhancing equity. More information is available at that website, farmershelpingfarmers.ca. Thank you.
Ben conducted a qualitative study of One Health focused on the unique experience of SARS in Singapore. He included veterinarians, conservationists, epidemiologists, public health, and bioethicists in a review of the 2009 H1N1 flu pandemic and the expectation of the next pandemic. While the One Health approach framed Singapore's future response to pandemics, the normative questions were far less clear. One Health ethics called for a reorientation to both human and non-human indices of health, and the wider study of biospheres, ecosystems, and social networks. Ben's work focuses on challenges of fairness in the One Health approach across a range of bioethical and legal issues. He argues that there are 3 kinds of environmentalism found in an ethical, coextensive space, and that space is defined as an interspecific community of rights.
Hello, my name is Hélène Carabin. I'm a professor at University of Montreal in Quebec, Canada. And I just wanted to talk to you really briefly about my Canada Research Chair in Epidemiology and One Health. So what we do within my group is to try and better incorporate and develop, when needed, advanced epidemiological methods linked with biostatistical methods in order to better investigate One Health issues in Canada and in low and middle income countries. This is difficult because in epidemiology we have different sorts of biases which replicate amongst the different animal species or the environment which we are studying. Therefore, this requires special methods, and this is what my group is working on. Hello, my name is Hélène Carabin. I work at the Université de Montréal in Quebec, Canada. And today I just wanted to talk to you about the GRESO, which we call the Groupe de Recherche en Épidémiologie des Zoonoses et Santé Publique. This is a partnership between the University, Public Health Agency of Canada, and the Canadian Food Inspection Agency of Canada. For 25 years, this group has been studying the epidemiology of zoonoses and how it might impact public health and animal health using a One Health approach. The group is very large. We have more than 100 members, all speaking of epidemiological methods, biostatistical methods, mathematical modeling, of zoonoses in order to inform governments and prevent infections. Thank you.
Lisa Carver is an associate professor in the Faculty of Health Sciences at Queen's University. Her journey to a One Health perspective grew out of research with older adults. In talking with them, she discovered that relationships with non-human animals were a priority to many of them. The well-being of non-human animals they shared in their homes was as important to many of them as their own well-being. In case of emergency, many would refuse to evacuate rather than leave their companion animals, which included dogs, cats, chickens, horses, pigs, cattle, and ducks. They were also concerned about the well-being of the environment and human impacts, such as pollution, climate change, poor recycling outcomes, deforestation, and human-made disasters. Her current research includes ethical and practical concerns associated with human and non-human animal well-being. She teaches a One Health course at Queen's University and is a member of the One Health Social Science Initiative and Canadian One Health University Network.
One Health has been a signature focus at Trent University since Trent was established in 1964. We see ourselves as engaged global citizens who are catalysts in developing sustainable solutions to complex issues, including those that fall at the interface of human, animal, and environmental health. As an example of our growing One Health footprint, the United Global Plan of Action for One Health and One Climate is a project led by Trent University with the International Institute for Environmental Studies that supports student and faculty-led international research projects that focus on the adaptation, response, and resilience to a changing climate. In 2004, we introduced a new upper year course in One Health in the Department of Biology. We have been leaders in environmental aspects of One Health by focusing on healthy and sustainable environments and communities, and continue to expand research and teaching in One Health with growing investment in agricultural research and animal health and biodiversity. Trent University's One Health focus also includes a strong commitment to social justice and truth and reconciliation.
At Toronto Metropolitan University, we integrate One Health concepts and case studies throughout our undergraduate and graduate curriculum. At the undergraduate level, we have 2 bachelor's programs, one in occupational health and safety, where graduates go on to be OHS professionals working in a variety of different workplaces, and then an environmental public health undergraduate program where many of the graduates become environmental health professionals, such as public health inspectors. And across both programs, there are some common courses where One Health concepts are integrated, including environmental health and emergency type courses, and case studies are integrated throughout the various courses. At the graduate level, we have a master's program that is thesis-based, and some of our students are also working on One Health types of projects in this program.
Hello, my name is Samira Mubaraka, and I am an infectious diseases physician and a medical microbiologist at Sunnybrook Health Sciences Centre in Toronto. I'm also an associate professor and a clinician scientist at the University of Toronto in Toronto, Ontario, Canada. It's my pleasure to brief you on some of the work that I've been doing with the Wildlife Emerging Pathogen Initiative, or WildEpi. WildEpi is a collaborative research group focused on viruses in nature and viral zoonoses. We strive to address key questions around host pathogen interactions at all scales of work, from molecules to populations and landscapes. Taking a One Health approach, we have partnered across a range of social sectors, including the public sector and academia. Our approach is based on a workflow that starts in the field and leverages host and pathogen genomics for hypothesis generation and validation. We have established fit-for-purpose analytical pipelines and collaborated broadly to establish novel molecular and in vitro cell models to study how viruses interact with wildlife, livestock, and human hosts. We also examine landscape and host population connectivity, which further guides sampling strategies. Ultimately, these data inform policy recommendations and decision-making at local, provincial, and national levels. Knowledge mobilization is enabled by close partnerships with organizations such as the Royal Society of Canada, who have hosted multiple One Health and emerging zoonosis engagement events involving academic and public sectors. Together, we also published policy recommendations aimed to strengthen a One Health approach to emerging zoonoses.
I am Francisco Lea Popelka, the One Health Chair at the Schulich School of Medicine and Dentistry at the University of Western Ontario in London, Ontario, Canada. Here at Western University, we offer the students both an undergraduate and a graduate program in One Health. Undergraduate students can get a Bachelor in Medical Sciences in One Health, and also students can get a double major in One Health. Graduate students can complete both an MSc or a PhD in One Health. I am a veterinarian and epidemiologist, and my professional area of interest has been bovine, human, and zoonotic tuberculosis. I work with both academic and non-academic stakeholders on different initiatives of global importance to address the challenges posed by Mycobacterium tuberculosis complex species in domestic animals, wildlife species, and people in different environments globally. Thank you very much.
Human, animal, and environmental health are all connected. Changing something about the environment is going to change everything within it, and that includes the animals, that includes the wildlife, the domestic animals, the people, the plants. All of those things have these knock-on effects. It's actually the whole encompassing environment in which everything takes place. One Health can be viewed in a very soft manner, like a group hug, like, oh, you know, humans, animals, environment, all in harmony and everything's great. But One Health isn't just a group hug. One Health is also the solution to really wicked problems, problems that humanity has been struggling with for centuries to overcome. And so to address those wicked problems, we talk about building the next generation of One Health scholars who will be the wicked scientists that we need to face those wicked problems. It's not just a question of having an epidemiologist and a veterinarian at the table. You can give me any department across campus and I can tell you how they would be necessary on a One Health team. You need to bring people who have depth of experience in their particular fields to the table so that collectively you end up with this huge breadth and depth of experience to address those things.
My name is Dr. Simon Otto. I'm an associate professor at the University of Alberta School of Public Health. I'm a trained veterinarian and have a PhD in epidemiology. I'm the lead of the HEAT AMR research group, the Human, Environment, Animal Transdisciplinary AMR group. We study the One Health epidemiology of antimicrobial resistance to provide evidence and information to support antimicrobial stewardship strategies so that we can stem the tide of AMR. I'm an executive member of the Canadian Antimicrobial Resistance Network, which is a CIHR-funded One Health training platform, as well as a member of the AMR One Health Consortium on the executive. I teach an undergraduate and graduate course in One Health, which is a course requirement for the newly approved undergraduate embedded certificate in planetary health at the University of Alberta.
At the University of Calgary, One Health isn't just a theme, it's a core philosophy. It's a mindset that shapes our approach to solving the world's most complex challenges. As a cross-cutting priority, One Health reflects our deep commitment to transdisciplinarity, breaking down traditional silos to recognize that human, animal, and environmental health are inextricably linked. Our first 5-year plan wraps up this year, a period of incredible progress. We've made major strides in antimicrobial resistance, healthy water ecosystems, infectious disease, and fostering community well-being. Through research, innovation, engagement, and training, we've built a robust foundation. This creates tangible solutions that resonate within our local communities and extend to make a global impact. Now we're shaping the next chapter. The future of One Health at UCalgary is about connection. We aim to build strong, resilient networks that drive impact. One Health at UCalgary, connecting us for the future.
Hi, I'm Margot Parks on behalf of the Canadian Community of Practice and Ecosystem Approaches to Health. The rich reciprocal relationship between One Health and EcoHealth in Canada is something we've chosen to highlight by just giving a glimpse of some of the species that have guided our understanding of the 6 principles or patterns of ecosystem approaches to health. And these have been central to the learning that we've done in our now 18-year-old multi-site field course. Here are some glimpses. In Vancouver Island in 2008, we learned about knowledge to action through Cryptococcus gattii in Vancouver Island, with Craig Stevens emphasising the need to be writing policy briefs about what our students had learned. In Guelph, we were guided by Bruce Hunter to think about participation through the lens of carp in the Great Lakes. Meetings and interactions among our students and stakeholders will always stand with us. Many of us, including me, can't really think about complexity without thinking about chickens and the way in which David Waltner-Taves has been able to deepen our understanding. Over the years, other species have stood out. The lessons from Arctic research focusing on sled dogs have taught us about transdisciplinarity. During COVID, we became deeply aware of the equity dynamics of thinking about urban animals, including rats and others, from Vancouver to Montreal. And we have continued to learn from lessons from Indigenous colleagues around caribou and other species that help us to think about sustainability in ways that connect us with the living world and think about reciprocal relationships. And this is continuing now with thinking about land-based learning and how that can influence One Health and EcoHealth, all the healths, as we think about preparing health workers for the changes ahead. We're thankful for this relationship. We wish you well in your deliberations. Thanks for letting us share some glimpses.
Since its inception in 1992, the CWHC has examined far in excess of 300,000 animals, determining cause of death and/or testing for nationally reportable and non-reportable diseases. Data generated from these examinations are communicated to a wide range of federal, provincial, and territorial government partners, as well as industry partners and the broader wildlife health and academic communities. At the core of the CWHC is a partnership linking Canada's 5 veterinary colleges and the Government of British Columbia. Branching from that core is a network that stretches into the public and private sectors, allowing us to access the critical expertise needed to detect and assess wildlife health issues and make sure our results find their way to people who make decisions regarding wildlife management and use, public health, and agriculture. The CWHC exists to advance the health of Canadian wildlife, recognising wildlife health as central to maintaining sustainable relationships among wildlife, humans, domestic animals, and the environment we share.
Hello, my name is Jolene Giacenti. I'm a wildlife veterinarian focused on research, and I'm joined by Trevor Thompson, a wildlife biologist focused on policy. We work together at Environment and Climate Change Canada, or ECCC, to connect science and policy in support of One Health. ECCC is a federal government department in Canada with a mandate to conserve biodiversity, including migratory birds and species at risk. At ECCC, our One Health approach is grounded in our conservation mandate and emphasizes collaboration across sectors, stronger surveillance and preparedness, recognition of nature-related services, and support for Indigenous rights and traditional ways of life.
Our work aligns with ECCC's departmental plan and the Interagency Pan-Canadian Approach to Wildlife Health, our National Wildlife Health Strategy, which you can learn more about by following the QR code. We work on a wide range of files that support our mandate and deliver shared health benefits across the One Health spectrum. Some are pathogen-focused, such as avian influenza and chronic wasting disease. Others are species-focused, like our bat health program, and we also monitor environmental factors like contaminants. In each case, we collaborate across human, animal, and environmental sectors because the drivers and impacts are cross-cutting. At a high level, this work covers prevention and preparedness activities, surveillance and response, research, and extends to policy development and communication. Please get in touch if you'd like to know more. Thank you.
Hello, colleagues, and welcome to Canada. My name is Sarah Vivek, and I'm the Chief Science Officer and Vice President of the Science and Integration Branch at the Public Health Agency of Canada, Canada's National Public Health Institute. Here at the Public Health Agency of Canada, a One Health approach is imperative to public health and grounds our work. It recognizes the interdependency of the health of people animals, plants, environments, and other ecosystems. And it mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together. One way we're making this concept concrete and applying it to our work is through a One Health approach to risk assessment. This approach provides the roadmap of how we would consistently apply a risk assessment process for risks that cross boundaries and ecosystems. The development of our One Health approach to risk assessment provides the operational guidance of roles and responsibilities across organizations, sectors, and experts in order to integrate and interpret evidence to inform risk assessments, provides a mechanism to work in areas of concern where gaps in risk assessments exist, strengthens networks and interactions, and supports the co-development of scientific products. This supports improvement to communication, collaboration, coordination, and response to risks across multiple sectors, levels of government, and experts. To learn more, search our One Health approach to risk assessment on our Public Health Agency of Canada website.
The Canadian Integrated Program for Antimicrobial Resistance Surveillance is Canada's national foodborne AMR surveillance program. It integrates data from humans with enteric infections, well animals on farm, at slaughter, and retail food, as well as sick animals, and combines that with antimicrobial use information from humans and animals. It was developed in 2002 with a one medicine concept, integrating human and animal health, albeit with a primary mandate for human health. Over time, it has transitioned to a One Health concept, particularly through amalgamation with FoodNet Canada, our Sentinel site-based foodborne pathogen surveillance program, which includes a lot of the same components, but also includes an environmental component primarily focused on surface water. Both programs are operated by the Centre for Foodborne Environmental and Zoonotic Infectious Diseases in the Public Health Agency of Canada, along with multiple partners. Other examples of One Health surveillance programs, in fact, include the West Nile virus surveillance program, which also integrates information across the One Health continuum.
Hello, I'm Kate Dewey. At the University of Guelph, One Health has a long history focused on foodborne and zoonotic diseases. Beginning in the 1980s, the term ecosystem approaches to health was used to include the environment, social sciences, and most importantly, community. Dr. Beth Finnis, the current director of One Health Institute, is a social scientist. The One Health Institute has over 160 affiliated faculty members representing all colleges across campus. Its website lists the members in a searchable database that is used to build research teams. The communication and outreach of the Institute is significant. You are welcome to sign up for the bi-weekly newsletter and follow us on social media. We cover One Health events and research from around the world. The YouTube channel includes past monthly seminars. Our 4-year Bachelor of One Health includes 4 different streams to enable students with vast areas of interest to work together. The collaborative graduate program welcomes master's and doctoral students from 19 departments across campus. Students gain disciplinary expertise while using a One Health approach to their research. The 7-week Mobilizing One Health microcredential is designed for working professionals. In a fully online program, participants work on real-world, complex One Health problems in multidisciplinary groups. In 2026, we plan to launch a new Executive Masters in One Health Leadership. Canada Research Chairs are funded by the federal government to enable faculty members to spend most of their time on research. These One Health researchers are in colleges across campus. Many other faculty members are hired specifically to work in One Health.